Hello again with our show Doctor of Life. Today we will talk about erectile dysfunction and premature ejaculation. And they are a big problems to the married couples because they doesn't think that there is a cure. Today we will open a door of hope to these people and the people who suffers from diabetes. And we will know that is the countervailing stent with our doctor Alaa Ajlan. At first, we want to know what is the premature ejaculation means, its reasons, and what are the latest ways to heal from it.
Premature ejaculation, considered one of the most common sexual diseases. 40% of men all over the world suffers from it. It had many reasons, as it organic or physiological disease. With our researches and works, we found that it's not only cause, there is also organic reasons. This problem caused many cases of divorce, but now we heal that problem very well. The doctors were given the patient antidepressants as a cure, such as Poxetine, but it had many side effects. Also, there are many people doesn't respond to it. There are 3 operations under my name: Alaa Ajlan 1, Alaa Ajlan 2, and Alaa Ajlan 3. At first, we give the patient pills. If he doesn't respond, we do the operation. There were many surgeries like cutting the nerve or inject the head of the penis. Some cases healed, but the other doesn't. So I started to know why in a clinic way. And the histology found that the census on the head of the penis is less than the census on the fingers, and they find out that by vibrator estimation. The process works by pressure receptors, and there is a glans vessel reflex. When we push on the head of the penis, contraction happened on the vessel that carry the sperms, and also a contraction on the pulp sponges. So there is a connection between these two, and started to cut the muscle on one side or the 2 sides, and maybe remove it all. Some patients healed, and the other doesn't respond. Then, with my researches, I found that there is a place called delta. It's like the G-spots in the woman. When I removed that delta, I found out that there is a great success on ejaculation. Some patients doesn't prefer the surgery, so they put on the delta some spray, and it also works. When we did that surgeries, I found that the success reaches to 97%, except that 3% of the patients that suffered from increase of the secretions of the brain. So we have to do the operation and give him pills together. There is increase in the secretion of the serotonin of the brain. The operation took only 4 minutes and go out the hospital at the same day. But he cannot have sex before 20 days. The time of sex increased from 200% to 1000%, and some rare cases reaches to 2000%.
The AD erectile dysfunction is also a problem, and a lot of men suffered from it in way or another, and if they have diabetes or not. So the stents opened a great hope for them. So, what is that stent and its role?
We called it a solution who searches for a problem. It's a solution to all the problems. I'm using it when I have no medical solution. I made to the patients 2 things: diagnostic test and the drug test. So I asked him to do raise on the penis to see the cumulative sugar on the penis. And the drug test, I gave him Viagra or other stuff and see what will happen after a week. So I recommended that if the patient took Viagra and was going to make a raise test, he have to wait 36 hours at least to take the best solution. And there is the venous sclerosis that increased by time. At first it heals with pills and some machines, but after that he have to installation a stent. So I am always sees that if the patient wants a stent, first I see the cumulative diabetes, and it had to be 7 or less. There is a very important point in a stent that it's shortened the penis from 2.5 to 4 centimeters. So I do the surgery and enlarge the penis when I stent, and that is a unique surgery. Some patients come for me and they have a small penis and no erection and also suffered from premature ejaculation. So I do the surgery and put the stent and do my operation to enlarge the penis and remove the delta. So the stent is like a silicone pen inside its silver. I do with it the ventral sinuplasty. Then I put lipid trait injection to increase the thickness of the penis. Some doctors say that there is no such a thing called enlarge the penis with the stent. But but no, there is such a thing. Safaperforce at the 20th century made it and it worked very well. And it worked very well and it called Biphoric technique. So I do the radical solution to this problem. The stent only takes 20 minutes and they can have sex after 40 days, months at least.
Thank you, doctor, for these great informations.